Hey everybody, Dr. Derek Gatta, co-founder here at RiseWell. Excited to have our conversation here with Dr. Adam Silevitch, who's an expert in pediatric dentistry out of New York City.
Hey Derek,
Dr. Adam, how are you?
I'm great. How are you? Happy Friday.
Yes, absolutely. Good to see you.
You too. Been a minute.
Absolutely. But we're excited to have you here. I know your time is valuable and just wanted to get your feedback on all things pediatric dentistry today. But go ahead and give the audience some background on you, what attracted you to dentistry and specifically pediatric dentistry and kind of how your journey has evolved.
Yeah, so I'm born and raised in Boston and went to BU Dental School and did my residency at Columbia for pediatric specialty training. My whole life, I've always kind of gravitated towards working with kids, whether it was babysitting at a young age or camp counselor. So when I was in dental school, I was like thinking to myself, I have this special skill to have like a special amount of patience for kids. And if I can do well enough in school to get into a pediatric residency, I think I should lean into that superpower. So I did, and I love my job. I love my industry. I love working with families, and really, what a gift to see kids grow up with you. And that was always kind of like my vision of my for my career is to like help people and like see kids grow with you, see what kind of adults they become and their life stages and their triumphs and their challenges, and just be kind of that cornerstone in their life that they remember fondly about. And, we all have parents in our practices that sit in the chair watching us work, and you can see their own kind of traumas coming out from their own childhood. And I
Absolutely.
didn't want a generation of kids to have that. So I really lean into the whole body approach to dentistry. I have a psych degree, and I really lean into all of that aspect of dentistry. I think we take for granted the idea that like we just get access to someone's mouth. I think you have to earn that trust
Sure.
to be able to get in there and help the kid with their teeth. So yeah, I love my job, and I'm based in New York, as you know, and we have a whole host of different types of people, patients. I love the diversity.
No, I love that. Thank you for sharing your journey. And, I thank God every day we have people like you, pediatric specialists, because that is not my specialty. I mean, thank the Lord I can refer patients to someone who has the patience like you to help those folks, because I couldn't do that. But pediatric dentists have a special place in my heart, too, because as a kid, I broke my front tooth. And I'm just so thankful that we had someone in the community who could help me out. And they were conservative, and we just did okay. We'll try and just save it with a composite bonding and see how long that lasts, and
Hmm.
nurture that thing along and buy some time. And luckily, they weren't aggressive and didn't talk about any more invasive treatments like a crown or anything that was maybe a little too much at that point in my life. So very thankful for that. But
Yeah.
also, when parents are starting their journey, what is on the first step of looking at trying to create young children with a healthy mouth for a lifetime? Where does that begin in your world?
So, it's interesting when parents come to me for their child's first visit, in the American Academy of Pediatric Dentistry and the American Academy of Pediatrics recommends the age one visit. And really that's about education. And again, that's kind of what RiseWell stands by as well, is creating that foundation, that dental home, so to speak, where you create that relationship with your practitioner and the environment that you're going to bring your kid to. And I think that's really paramount in setting the stage for good oral hygiene, good education, and good home care. And I think one thing that surprises parents is that once you get your first tooth, you can get a cavity. So the brilliance of RiseWell's products is that, you know, I tell parents all the time, like you can throw away your training toothpaste. Like they don't do anything. Once those teeth come in, we need something that's going to help prevent caries. And I'm constantly reminding parents that, we have to be careful of our diet and our hygiene, even when it's hard. So, when you have an infant who has, say, three, four, five teeth, on the changing table, get in there with a toothbrush, get them comfortable with this foreign object in their mouth, with the bristles on their teeth, and so that they can get used to the consistency of brushing at home, and that needs to be part of the routine at home.
I think that's
So that's paramount.
I think that's a lot of great advice. And just looking at some of my older patients too, there's a lot of confusion about like in what age of month or years to bring a new child to the dentist to start that, because a lot of my older patients are like, oh, they're just baby teeth, like they're gonna fall out, like is it really necessary, like shouldn't we wait till they have adult teeth or a full mouth? And there's confusion on when to start, and I'm like, no, please, it's got to be a lot sooner than that. But could you give like an age in months or years and when they should start seeing you?
So, like I said, the age one visits recommended. I think a lot of that really
Sure.
is education for the parents. In
Sure.
my practice, I recommend between 2 and 3. I think that's the sweet spot. And I also will encourage parents, if the kids have an older sibling, bring the kid earlier so that they can be comfortable in the environment, hear my voice,
Sure.
get presence, just feel the positive energy. I really believe in that. I think the more positive experiences these kids have around the dentist, the better when and if they break a tooth, like what happened to you, or have a cavity, that trust is there. It's similar to, your child going to school or a camp counselor, where you want to expose them to the environment. Preschool kids start, they do an hour and then they do 2 hours, and they get accustomed to the environment. So it's the same with the healthcare practitioner as well. So the sweet spot's really around 2.5.
Yeah, no, thank you. That's great advice, and also, thank you for just really concentrating on the psychological aspects of treatment and customer service. Because I remember doing my pediatric rotations in dental school, and man, nothing against the older generation. I know they were trying their best, apparently, but like the way they kids were treated and traumatized from like the older generation and style of doing pediatric dentistry was like just kind of eye opening. It's like, wow, no wonder all my geriatric patients are just scarred from things that happened to them as kids and why they refused dental treatment, and then problems progress and advance because they just weren't confident in the system. So thank God things have gotten better in the customer service front. So thank you for that.
Well, it's
Also,
definitely something not to cut you off, but like my practice is a boutique concierge kind of vibe,
sure.
and I'm managing one column of patients a day, and they get a lot of face time with me. And I think that's really paramount. I always my quiz question to parents who, that I run into here and there and everywhere, and who maybe aren't my patients, but I say, who's your kid's dentist? And when they say, oh, they go to Smile Buddies or whatever, and I'm
Some
like, man,
change.
that's such a lost opportunity that you
Yeah.
don't know who your kid's doctor is for their
Yeah.
teeth. And to me, like, that's the special sauce where you're literally curating this relationship that you're going to have for multiple decades and
Yeah.
set them up for success. And, I just think it's just such a lost art. And I think our industry really needs to lean into that, that aspect of it, that this is a psyche, this is something you need to nurture, not just kind of like gloss over and say, okay, how many kids can I see in a day?
I can attest to that, folks. I've been to his practice. He's highly skilled. My nephews use him, so thank you for taking care of them, and absolutely, amen to that. I want to talk about nutrition for a little bit, and looking at some of the misbeliefs or common misunderstandings that families and parents have about what's an appropriate snack, what's inappropriate, and how it affects oral health and the formation of decay. And any thoughts on that?
Yeah, I think it's very easy for everyone to say candy, 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 right? Like that's just
Sure.
kind of the candy causes cavities. And really, it's multifactorial. It's diet, hygiene, and genetics, and they all interact together and they all interplay together. And what I really try to instill in my patients and their families is that it's the consistency and frequency of carbohydrate consumption that will encourage cavities. So when we're dropping pH in the mouth from acidic foods or acidic drinks, that's going to encourage the bad bacteria to cause cavities. So I'll tell parents regularly, I'd rather have your kid eat a Hershey bar than a raisin, because it's just sticky carbs
Yeah.
and sticky sugar. And if you have a 3-year-old who eats raisins, they're not going to pick out that raisin out of the back molar like we would. They're just going to leave it there and let it sit and let the bacteria, eat it all day long. And if you're having a hard time brushing your 3-year-old's teeth, like most of us do at home, you're going to have that constant cycle of sugar for the bacteria to create decay. And to kind of go back to your earlier point about, okay, well, it's just baby teeth, like who cares? Well, those molars and those baby molars don't fall out till 10, 12, 13, 14 years old. And those are critical for holding space for the adult teeth that want to come in, and also preserving the bone that is there and preventing uh, infection. And we see infection. And I think
Sure.
sometimes that surprises parents that, like, you can get an infection from cavities in your baby teeth.
Yeah.
And that is a whole body thing, right? Like if that infection is localized, it can become not localized and create facial swellings or worse. And so I think it's really important that we're promoting health. And I think thankfully there are more resources out there where parents recognize that the whole body health is important, and the mouth isn't just confined to its own silo, and everything is connected. So baby teeth are important to take care of.
Yeah, it's really great that you take a holistic approach on that, and I couldn't agree more with just really understanding that the mouth is part of the whole body, and what happens in the mouth affects many downstream events from that. And it's also interesting when you look at what the economic cost is of, say, trying to treat this preventable disease. I mean, it's a super common disease in young children is decay or caries. And when you look at lost school time, okay, you got to take your kid to the dentist for an unanticipated dental emergency. That's lost work time for the parents. And all these downstream ripple economic effects of not starting things early, not talking about nutrition, not addressing oral hygiene, and just really trying to nip it in the bud, this super preventable disease process.
Yeah, and it's amazing. In the last 2 years, I've had a dramatic shift in my practice with some new technologies that help me detect cavities even before they're visible on an X-ray or even with my naked eye. So I'm able to diagnose earlier, and I'm using a product from Switzerland that can reverse and or stop the cavity process before we have to drill a tooth. And I've seen a reduction in my fillings by 40% in the last 2 years. And
That's
to me,
fantastic.
yeah, it's an incredible technological advancement, and it's totally transformed my practice, which was already a conservative practice,
Yeah.
to like a minimally invasive, non-invasive um, place for patients to go. And I joke with my patients, I'm probably the most minimally invasive dentist on the planet at this point.
What's the
And
what's the service, or how do you accomplish this?
So there's a toothpick that was invented by an Israeli orthodontist at Tufts and Harvard,
Yeah.
and it's called CaviSense, and it
Yeah.
basically can detect early stage cavities before they're visible on an X-ray or with my eyes. It detects the pH changes in the plaque biofilm, and we know that caries is a disease of pH. And so when the pH drops and you have acidic bacteria and byproduct, it demineralizes the enamel and creates a hole, which is a cavity. And I'm able to detect this active caries at its infancy. And if I can detect it at its infancy, I have this proprietary peptide from Switzerland called Curadont, which is made by Vivardis, that I can put on the teeth, and it can stop the carious lesions. And I'm seeing reversals of incipient lesions. I know I'm kind of getting a little down dental road here with terminology, but it's a fantastic product. It's totally transformed my practice.
I
And
love that.
and
I
it's
love you.
amazing. I have parents now asking me if I will put it on their teeth
Yeah.
because they were at their dentist and they had a small cavity or et cetera. And it works on not just baby teeth, it works on all teeth, all enamel. So pretty
That that
cool.
sounds like a fantastic protocol, and glad that you have some ultra advanced partners and people to help with that. And again, looking at the nutrition side of things, it's interesting too. Even in my practice, I don't treat children, but geriatric patients and middle aged patients, a lot of them are so curious as to why I keep harping on nutrition and why they're so curious about what they eat. And I keep trying to remind them, and like you said, it's not just dessert types foods. I think people need to realize that pretty much everything you eat is going to break down into some type of fat, sugar, or protein. And if you're not eating two of those agents, everything is going to reduce to some kind of simple sugar, whether it's a type of quote unquote sweet dessert type food or crackers, pastas, and cookies and those type things. I mean, they just at their elemental level are some kind of glucose molecule. And a lot of patients, they don't realize that. If that plaque layer sits on the teeth, as you mentioned, the pH drops into that carious demineralization zone. You start losing the phosphate and calcium from the tooth structure, and it just kind of goes downhill from there. So just really educating people on the nutritional side of things and how it's within their power to just get the plaque off the teeth and prevent that pH from dipping down low.
And I think also too, I think people expect, okay, they come to your office and they have, crowns done or fillings or whatever the case may be, restorative dentistry, and they just expect that, okay, like it's all good, I'm good, I don't have to worry about it anymore. And teeth expand and contract, and bacteria can get under areas of restorations, and that just starts the cycle for the next restoration that needs to be done. And I think you have to take care of what the work is done. And I'll instruct my teenage patients all the time. I'm like, you have to lean into your part of this. Like, if your parents are spending the time to take you here, and I'm going to spend the time to fix your teeth or put the curodont on, you need to do your part. Like, there needs to
Absolutely.
be accountability for not only kids but adults too. But the
Yes.
expectation of like nothing lasts forever. It's like your car, like it needs a tune-up, right? Like your teeth are constantly expanding and contracting with temperature
Yeah.
changes and consistency of the food, and whether patients are grinding at night. There's so much that your teeth undergo. It's amazing how long our stuff lasts.
Yeah.
Um, but it's really important for patients to get that education, for the doctors to lean into the education, or their hygienists or the assistants with the patients and their families about what they can do to prevent further issues down the road.
Hey, I love that they have you as a resource and you're educating a whole group. So that's fantastic. In addition to nutrition, other aspects of dentistry that I think a lot of people, I wasn't real super well trained in airway aspects of airway management and breathing. Is that something that's a part of your practice, or how does that work with the pediatric population?
Yeah, I think there's a big movement in leaning into this early airway management evaluation. I mean, I know you and I know that you learn some of it in dental school and in evaluation, but it's really not much. You just scratch the surface. And I think there's kind of like a sweet spot for me in my practice where I'm assessing early. I'll know when all the baby teeth are in if that kid needs to go to early orthodontia.
Sure.
And there's tons of studies done that when you see those perfect baby teeth that are all lined up next to each other, that's 100% chance that that kid's going to need early ortho. We like to see the spaces in between those baby teeth. And look, like, you have genetics from your mother and father, and the skeletal and dental relationship of the teeth and the bone all kind of like go into the soup, and that's kind of what you come out with. And I think we've evolved with our diets to have smaller mouths. We all know that most of us get our wisdom teeth out, and that's just from evolutionarily we've evolved to not need that third set of molars. But in my practice, usually around 6, 7, I'm sending, if I'm evaluating for early ortho phase 1 treatment. That might be a palate expander, but having an orthodontist take a look at those kids. But even to your point about, airway stuff, I know there's even movements now where, there are exercises or myofunctional things that are being done at an earlier stage. And, I caution parents with all of that, because what we don't want is burnout, right?
Sure.
So I think, yes, in theory, all of these things are amazing and certainly important to evaluate and to be on top of. But I don't want parents to forget the fact that you have a little person here that has to go through all of this. And on top of school and potty training and learning manners and everything else that goes into being a parent. And I just don't ever want the psychological piece to be lost, because you and I both know when a kid starts early ortho, say at 7, they're in ortho treatment, till they're maybe 12, 13 years old. I mean, that's a long time. And a non-compliant teenager is a nightmare,
Yeah.
because a patient that doesn't brush their teeth with braces, you're getting white spots around the brackets, you're getting caries, and the whole host of other things that can happen from poor oral hygiene. So, and that just comes from burnout. So I think all that needs to go factor in for each individualized kid. I don't have a blueprint for my practice, that just covers everyone. It's individualized, and that's how medicine should be. But proactive, I think that's really the key here.
Yeah, you make a lot of good points here. And again, full disclaimer, I don't treat children here, but I do treat a lot of parents, and I get asked anecdotally questions about their children, and I tell them, refer them to a pediatric dentist in my community, but I do say, do they have any advice on certain techniques in addition to nutrition and things we've already spoken about to decrease your risk of decay? I do recommend the nasal breathing. I mean, just keeping the mouth closed and really helping them to understand that encouraging nasal breathing helps to warm and humidify the air. Also, when your mouth is closed, it keeps your tongue up in the palatal vault to help that gentle pressure to help expand the arch as the child grows and kind of counteract that force from the buccinator muscle that pushes the teeth inward, to really help alignment of a full arch. So that's just one, anecdotal piece that I kind of give them as well. And also just looking at when your mouth is open, when you're breathing, it's going to dry and desiccate the mouth out. Saliva is super helpful to help combat decay and minimize that risk of dropping down into the lower acidic pH zone. So a lot of benefits come from nasal breathing. I don't know if I'm sure it's something you mentioned too. But is that part of the protocol, or how does that fit into your world?
Yeah, I mean, look, like you and I both know, you see gingivitis with patients who are mouth breathers, right? Like
Yeah.
you see that bulbous, reddish gingiva that, we're not happy with. Even if a patient says, look, I floss every day, I'm doing everything I can, and we still see it, right, in our practices. So I use mouth tape myself. I think that's a really easy, simple solution to help encourage nasal breathing. But I think that's certainly something that goes into, whether you're referring to a myofunctional specialist or an orthodontist or an ENT, or, looking at the tonsils, or does your child snore, or are they tired all the time? Do they have bags under their eyes? All these things go into the narrative. And then who to make the right referral to. But there are, like, to your point, very simple things that you can do. To encourage the nasal breathing at home in a day to day.
Yeah, thank you. And also, in addition to getting compliance from young patients and really helping them on their journey for oral health, how do we help the parents? Because I'm sure they're always saying, "Doc, I understand the advice, like I'm doing it, but it's a battle trying to get Junior to do procedure XYZ or brush before bed or whatever they're supposed to do." What advice do you have for parents to try and get compliance with the wonderful information you're disseminating, but actually getting the patients to get it done?
Yeah, so I mean, look, like I'll tell parents all the time, your mom, your dad, like they're not going to listen to you. So, use me as, when you build that trust piece, it's just like when you say to your kid, hey, like you need to do your homework. Mrs. So and so, is going to be upset if you don't do your homework tonight.
Yeah.
And, I kind of lean into that Uncle Dr. Adam, teacher kind of piece of like where I sit in the family structure here. And so one piece I tell parents is like, use me as a resource. Every parent in my practice gets my cell phone, and I want them to use me as a resource. I've had parents FaceTime me from the bathroom and literally have me watch their kid brush their teeth, and they'll threaten it. And it works. I mean, look, every kid
That's
is
funny.
different. I
Yeah.
think also you can't let the kid win a lot of times. And so I'll tell, and I don't preach in my practice. I will give them here's what we're looking for. Try to brush your kid's teeth twice a day. Try to floss once a day when the space is closed. But then there's just reality. Like being a parent's really hard. And sometimes you're not able to brush twice a day. And like, it's okay. Like I don't love the like mom guilt is what I call it in my
Sure.
practice. I think
Yeah. Yeah.
we're all doing the best we can. And especially in New York, like we typically have families where both parents work, and sometimes the nannies are taking care of the kid's teeth, or the babysitter, or the grandparent. And so there's a lot of factors that, the doctors even know about half the time. And
Yeah.
I think just being really gentle with your messaging, and then also saying to the parent, look, like if you have a 2-year-old, you have to brush their teeth. You may have to hold them down,
Yeah.
and teaching them the right techniques to do that safely. But at some point, your child will learn that this is routine. This is has to happen. And eventually they will give up autonomy. They'll give up that fight, that struggle, and they will allow you to brush their teeth. It happened in my own house. My 3-year-old did not want to brush his teeth. And it was a struggle. And, over, a few weeks to months, like they start to learn. And so I encourage parents to not be like afraid, right? I think it's important that we're showing when we need to be a little bit more assertive with our patients and our kids. And the other piece is, and this is, I did a cartoon for Sesame Street about going to the dentist. It's called The Feeling Wells. It's on
All
it's
right.
on it's on YouTube. It's like 2 minutes, but it's my
Nice.
voice. And so I'll have parents show their kids that, and that helps kind of reinforce behavior too.
Oh, that's fantastic. You're everywhere. That's great. So I'm curious, in addition to the importance of brushing, flossing in young folks with pediatric teeth while they still have open spaces and there's no real contact, is that something that you advocate, or is it not necessary with pediatric teeth, or what's your view on that?
Yeah, so I'll tell parents like, look, like I don't if you can see in between the teeth, you don't need to floss. I mean, obviously, if
Got it.
you see a big chunk of steak in there,
Yeah.
certainly floss it out. But I will
Yeah.
encourage parents when the spaces do close between the baby teeth, it is important to floss. And I encourage them not to use flossing sticks um, because one, they're not great for the environment. That's like an easy low-hanging fruit
Yeah.
reason not to use them. But two, they can act like a cheese slicer.
Okay.
So that floss is really taut between the two little like arms that the handle holds the floss in. And when you're pushing hard, it just cuts the gums, and the kids does not feel good.
Yeah.
And it's really hard to control it. So I actually encourage parents to just use regular floss,
Okay.
and so you have more control, and it's more gentle on the kids' teeth.
Deal. Yeah. Sounds good. Do you have folks that come in with adolescent patients and young folks that are looking to try and break tongue or excuse me thumb sucking habits or pacifier habits, or how do kids transition from having that oral fixation of a pacifier to kind of maturing off that device, and kind of how that fits into your practice and what strategies you have for that?
Yeah, I mean, look, I think that's like a very, very common issue that we all face as parents, and I've had it happen in my own house. And pacifiers pacify. I mean, there
Sure.
is a piece there where psychologically we keep going into this, but like it does help psychologically the kid calm down or relax. And I think finding that sweet spot, some of it is some parents are amazing and they just like rip the band-aid off and deal with the sleepless nights for a few nights and when the child is one. But then there are a lot of parents where at 2 years old, 2.5, they're still sucking and pacifier habits. And I tell parents, look, like you have your peace of mind, you have your bandwidth, like it's not going to be easy. Like here's my guideline in my practice. I usually say between 2 and 3, if it's not broken, like that's really
Yeah.
where we want to get to. Is that what it's in the guidelines? No, but that's kind of like just real world. Hey, like target this. Sometimes it's doable, sometimes not. Or maybe we do it around a birthday or a big event where the child like no, can understand that, hey, like I need to, stop this habit. But I would all tell parents too is like, especially with thumb sucking, you can't cut the thumb off, right? So it's harder than the pacifier, but
Yeah.
there's simple things like bad tasting nail polishes you can put on. There's little braces you can put on the thumb. You could put even a sock on their hand, or a band-aid, or have the kid um, go and pick out like fun band-aids that of characters they like. Make it fun. The research does show that if you are too aggressive with trying to stop the habit, it will make the kid more upset.
Got
And
it.
so when that happens, it will actually increase the habit. And so what I'm looking for when I'm checking in on these behaviors is, are we seeing improvement? Is the kid able to like not have the pacifier all day and all night? Is the kid only having the pacifier for naps or just at night when they're winding down or watching TV? Or if with the thumb, have they transitioned from thumb all day long to, okay, they don't do it at school? Check in with your teacher and ask, are they sucking their thumb at school? Or maybe put a band-aid on their thumb just as a gentle reminder for them to not suck their thumb. So little milestones like that can really help us understand if there's going to be a natural succession of the activity.
That's great. Yeah, thank you. I had been getting a lot of questions about that. Wanted to get your feedback on that. Circling back to nutrition, I'm curious as to what your philosophy is on helping parents deal with trying to substitute in better foods. I think we know what a better diet looks like, but just removing all the fun stuff I know can be challenging cold turkey. So, do you have advice on how parents can incorporate maybe better, healthier options as opposed to just an elimination of all the fun stuff? What great healthy stuff can they add to make it not so challenging to and quote unquote boring to have just a healthy diet?
Yeah, I think the first and foremost is like dried fruit is like the worst. And that's such an easy thing when you're sitting at the supermarket and you just see it sitting there and you're like, oh, it's fruit. Like it's good
Yeah,
for my
yeah.
kid. And it's like a jelly bean, man. It's just I've seen so many patients with cavities from dried mango and all that stuff. And I think reducing and eliminating ultra processed foods, I think is paramount. I think just for our whole bodies, and not just our mouths, but the frequency and the consistency of the carbohydrate consumption is kind of key here, and encouraging a lot of water drinking and like less grazing of foods. And look, like we're realistic. Like we don't expect kids to eat only fresh fruit all the time and only vegetables and celery sticks and carrot sticks. I mean, look, like there's time and place, and not having, say, for example, juice every day, or maybe once in a blue moon they might have a Shirley Temple at a restaurant. Like, look, like these things once in a while are fine.
Yeah,
We
yeah.
have to be realistic here, but it's really those kids that are, it's the Oreos and the jelly beans and the gummy candies, and even my teenagers, I give them a hard time because they're going to Starbucks and drinking the strawberry drink every day after school,
So much added
and it's
sugar.
loaded with sugar, or even
Oh
like
man.
sports drinks. Like
Yeah, yeah.
I'll pull up Google and I'll show my patient. I'm like, look how much sugar is in a bottle of Gatorade. It's like equivalent to Coke.
Unbelievable.
So, and I launched an outreach in Costa Rica 3 years ago, and we treated over 500 kids in a makeshift clinic this May. And it's fascinating because in their culture, they know to brush their teeth. It is instilled in their culture. They brush after every meal, but their diet is not great. They think Coca-Cola is water,
Ah,
and you just see rampant decay everywhere.
yeah.
And just to see it and to see the caries, and I'll show patients in my practice in the city pictures of these poor kids at 3 years old who need all their baby teeth out just from their diet. They are brushing their teeth. And so it really is, to your point on diet, like really, really important just to like stop and think about what you're giving your kid. And if they are going to eat stuff that might get stuck or not the best types of foods, then just make sure you're really doing a good job brushing, and not saying, oh, well, I'll get to it tomorrow. Tomorrow will be the day that we brush better. Yeah. So it's all about moderation, I think, for ourselves and for our children.
No, a lot of good tips there. It's like, oh, that's so unfortunate. One of our best exports is that cola. It's just, oh man, look, I'm a capitalist and all for companies doing well, but man, I feel like at some point these soft drinks should have a warning label. Like the level of sugar in these products is unbelievable, and I don't know if there'd be a class action lawsuit at some point, but man, the level of sugar and the damage, these downstream effects of just added sugar. That's one of the biggest things I've talked to my patients about. Is just trying to watch the soft drinks, the energy drinks, like the level, just the sugar and the acid together, and decay is
Exactly.
the decay is. I almost wish when decay was occurring, it was a painful process, because as soon as you had demineralization, if it was painful, people would know, something's going on. But the fact that you don't really feel anything until it breaches the DEJ, gets into the dentin, and then at that point you start to feel it, like, oh, there's a problem. But by that point, it's kind of an aggressive decay lesion, so it's almost unfortunate you don't feel it sooner. So just talking to my patients, look, if you can do one change in your life, just try and minimize or avoid soft drinks, energy drinks, and just stick with water, because the level of acid and sugar is just off the charts.
And also, too, people think that, oh, well, it's Diet Coke or Diet Soda. Like, that's not
Yeah,
better.
yeah.
I mean, the amount of acid that is in these drinks is just destroying people's teeth. And when you see it on a scale like in Costa Rica or in other countries where that's all they're drinking, it is really
It's so sad.
it's an eye opener. So
Let's get a warning label on those products. New
I
York
know,
City warning
right? All
label.
right, we're gonna advocate for that.
Oh man. Well, thank you for the tips on nutrition, and also looking at phobias and fears and anxieties. Like so many young people, it is, look, the dental office is an intimidating place to go, and sometimes it can stem from parents. If parents had a troubled childhood of neglect and decay and fear and phobia at the dental office, it's probably going to trickle down to the children. And even these little offhanded comments that people make, like, oh, you're going to the dental office, like how many teeth they're gonna pull, or looking at how Hollywood treats dentists and
Yep.
vilifies them as a scary place. Like all these subliminal messages really conditions young people to fear the dental office, unfortunately. So, how do you and your team try and combat that and change the narrative on what pediatric dentistry can offer and how to help folks minimize those anxieties?
I love that question because it comes up so often because parents don't even realize the nonverbal
Sure.
behaviors that they're exuding with their kid. And you can see it. The parents are white knuckled in the chair watching me work. And I encourage every parent in my practice to sit in the operatory with me, whether it's for a checkup or an extraction or a filling. I want them to see how it can be positive. And I will coach parents. I will pull them aside and say, hey, look, like you might, I can see that you have some, anxieties or traumas around your own, dental care, and maybe you're not the right caregiver to come. Maybe dad should come, or maybe the nanny should come, or grandma. And but I say it in like a kind way of like, hey, like we have this like blank canvas here that we can nurture. And one of the pieces that I really am proud of in my practice, I haven't sedated a patient in 15 years, since
Wow,
residency.
that's
And
great.
in our industry, it's so easy for the dentist to say, pediatric dentist say, you know what, Billy's got 8 cavities. We're just going to do it all at once, mom. Like we're going to put him under, and we're just going to fill all the teeth, and
Wow.
don't sweat it, and it'll just be one visit. And I really am not for that approach at all because one, sedating anybody, whether it's a adult or a child, is a big deal, and I'm not willing to
Yeah,
risk,
yeah,
God forbid, something bad happening. I certainly use a lot of laughing gas in my practice, which is very safe, but I want to coach these kids on how to be patients for the rest of their life. If you don't teach them the skills to be able to be a patient, work through those feelings, the slight discomfort of having mouth props in your mouth or having the drill in there, the sounds, all these things, it doesn't have to be a negative. You can
yeah,
actually turn it into a positive experience. And to be honest, I mean, I would say the majority of my patients who get treatment with me, they look forward to coming. It's probably partially because of the laughing gas, but
yeah,
we make it fun. Like I give them ice cream coins from Van Leeuwen. To reward them for good, for being good patients. And we want to make, like, I'll order toys from Amazon, like whatever it
yeah,
takes to
yeah,
just positive reinforcement. It's psychology 101. And it really, if you take the time to slow down
yeah,
and just say, hey, I will hold your kid's hand through this. I will coach you through this. And it may take 3, 4, 5, 6 times before you can even start to do the treatment. But
yeah,
as long as the parent is willing to buy into that approach, where we're going to nurture the psychology of the child, it just sets the kid up for so much more success when they're an adult, and when they need their own treatment. And I'm a firm believer in, like, if you put the time and energy into it, and it doesn't always pay, right? Like, you just have an empty slot, you wasted a half hour in your practice, like,
yeah.
yeah, but you got to do it. You have to. Like, it's, to me, like, that is the piece that, unfortunately, not enough practices lean into.
Yeah, I give you a lot of credit and want to applaud your efforts there because, like you say, a lot of it just because comes down to time management and trying to balance that. And not every practice is probably willing to make some of those business sacrifices in the best interest of the patient. So I give you a lot of credit. I know it's not easy to do that. I'm also curious, what are some of the biggest pitfalls or mistakes you see maybe children or parents making, or misconceptions about best practices for oral hygiene for pediatric patients? Any common themes you see and mistakes parents are making that we could easily correct them?
I think one of the big things is, like, just the type of toothbrush they're using.
Sure.
So a lot of parents will use, like, too firm of the bristles of the toothbrush. I think people think you need to scrub your teeth like a toilet, and you, it doesn't work
Harder is
that
better.
way. Yeah, it's not. It's gentle brushing. And I also, one, like, um pro tip that I like to tell parents is that use your opposite hand to pull their cheek out of the way, the child's cheek out of the way, so they can actually see where the toothbrush is going. If
Okay.
you're trying to face your child and, like, stick the toothbrush in there, and the kid's moving around and you can't see anything, and you're like, all right, done. And I encourage parents to stand behind your child and have them rest their head against your belly or your chest. Have them put their chin up to the sky, use your opposite finger to pull their cheek out of the way, and actually like get in there and see where the toothbrush is going. And a lot of times, not only are you going to get better brushing, but you're going to get better compliance from your child because it's not going to be as uncomfortable because you're actually going to be brushing teeth and not brushing their tongue or their cheek or their gums or, brushing too hard. And you can actually just be really gentle. And I think that really encourages better behavior at home when you're trying to brush your kids' teeth.
I love that. Yeah, thank you so much. Well, Doc, we're really getting up to kind of our time for today. I'm really super happy and supportive that you're able to join us today and give our audience some great nuggets of information. I'm curious, what future projects do you have going on? What has you excited about pediatric dentistry, and how can we support you?
So I'm doing a lot of leaning into this minimally invasive, non-invasive approach to dentistry. I've been doing webinars and lectures, which I'll promote on my Instagram as they come up, where I call it the Innovative Preventative Enamel Remineralization Protocol, where we are doing remineralization of enamel before having to do fillings and diagnosing before we're having to do fillings. Because we all know when you look at an X-ray, it's a snapshot in time. When you see a cavity on an X-ray, that cavity didn't pop up in a day. That was
Yeah,
happening over
yeah,
weeks to months to years. And so if we're able to diagnose earlier, we can treat earlier. And with non-invasive techniques where we're saving patients time in the chair, saving patients the necessary need for having to have local anesthetic, and saving the parents money. And I think it's a win for everybody, the child, the parents, and me, because I have happier patients and I can spend less time doing fillings and more time giving high fives and hugs and really being an advocate for early intervention, early treatment, and non-invasive treatment.
I love that. Does hydroxyapatite play a role in that for you?
It does.
Fantastic.
Yeah, of course. That's the linchpin here, where it's all about hydroxyapatite. That's what's helping remineralize that enamel. So that's why I love our collaboration efforts together. RiseWell is was you guys were the first, right? So, I'll tell patients all the time, like, you know, using that training toothpaste or that holistic toothpaste that doesn't have any science behind it that's going to help prevent caries or remineralize enamel, like just throw it in the trash, man. Like just go to Risewell.
Well, hey, I appreciate all the support, and yes, we were definitely one of the first. Boca was also one of the first here, but appreciate the support and everything you're doing for the profession. Pediatric families are lucky to have you in the New York City area. Go check out his videos, everybody, and keep leading the good fight, Doc.
Thanks, man. Appreciate it.
Thanks so much. Take care.
All right, you too. Bye.
Bye.